Okay, so you try different techniques, you do, I imagine, quite simple things, you do something which gives them an experience. So rather than trying to convince them, it just gives them a state change and they go, okay, well, I feel better now, right? So they're going to get some pain relief, some stress relief, and then it's like, okay, you've sort of sold it at that point, I imagine.
Yes, they can complete radiotherapy treatment, they can have chemotherapy without extensive vomiting, because part of vomiting is a conditioned reaction of our body. So it really works. Just we need to take the vagus nerve, look him in his little nasty eyes and tell him, now I am in control and you breathe with me.
I'm the daddy now, vagus nerve. Yeah. And does it impact you? I mean, most people aren't used to being around so much hardship. You know, I've done some humanitarian work, I've been to war zones, so I've got some experience, but you know, most people aren't used to being around the kind of suffering that cancer causes. How is it for you, like on a daily basis, being around that?
Oh, luckily, as a therapist, I had a lot of personal therapy and I have nice friends to share, but some things cannot be unseen.
Yeah.
So there were things that changed me forever. And I am not sure, is it a part of my wisdom and experience, or whether it's just trauma.
Well, you have this humor of someone that I've seen your humor before. I have a bit of it. I've seen it in concentration camp survivors. I've seen it in soldiers and firemen. And you don't see it in civilians very often. There's a certain way of, it's actually a kind of joy of sort of laughing at life and not taking it too seriously. And for me, I experience it as sort of feeling, but not getting too caught in the thing. And simultaneously knowing how bad life can be, but choosing to sort of smile and laugh. That's kind of my approach to it.
Yeah.
And it's been interesting. Is it something similar for you? It looks like I sort of felt like you're a bit of a kindred spirit in some ways when I saw you, you know, do the interview with Steve, and you know, Steve's doing his nice smiley, jovial Australian thing, and you've got that slightly cutting, slightly biting, partly East European, partly I've seen some real shit, you know, you can't unsee. And yeah, I'm kind of curious about that personally as much as anything.
Okay. This is my basic character, you know. I went through a lot. But as a child, I decided that Christianity is totally not for me. So I wanted to be something else. And I decided to be Buddhist when I was 16, and I started to practice. So it's been a lot of years. And I believe I'm still this angry, impulsive person, but a different one. Yeah.
But it's training on top of that, yeah.
Yeah. Buddhist training is totally important, and probably I will be much more personal and sentimental. I'm not sentimental. Maybe this is this part that you see in me now. I'm not sentimental, and that helps me to help people in totally every situation.
Yes.
Yesterday, my patient who had a large brain tumor, he called me, I'm vomiting, I'm feeling bad, let's reschedule the session. And I asked him, did you finish your vomiting? He said, yes, so let's start the session. But he said, but I have vomited on my computer. So I said, oh, I'm so sorry. So let's reschedule it. And he was scared that I will reject him because he was vomiting. And
right.
Honestly, that's nothing.
Right. There's something in when you've seen a lot of shit, people can pick up that you're not going to judge them. Mm-hmm. You know, like when I've talked to soldiers about their trauma, you know, and I tell them a couple of stories so they get that I may understand a little bit. And then there's a way in which they open up because they go, okay, you're not going to judge me that I've done some heavy shit. Or that I'm vomiting, or that I look like crap, or my hair's fallen out, or whatever the particular thing is, right? People need to feel not judged, and they need to feel that you've seen enough dark stuff that it's not going to freak you out as much as anything. I think people are defending you, right? They're like, it's like, I don't want to freak out the therapist, and I don't want to freak out the trainer or the coach, and so you have to let them know it's not going to freak you out. And sometimes a joke helps. Sometimes being a bit of tough love as well, right? Being like, because it's like no one wants your pity. Is my experience is no matter how bad the situation is, the pity is what they want.
Pity is not helping at all.
Yeah.
But my patients generally feel that shitting your pants or vomiting or bleeding or I don't know, anything, shaking. I will accept everything. And this is what Stan Grof said, that the therapist must be ready for cathartic experience of the client and must be ready for everything so that everything could happen. So I have a large space for everything that could happen. Yeah. So people are telling me really dark things.
Because it's almost like I feel like clients sense if you can't handle it as a therapist, trainer, coach, whatever, if you can't handle it, they won't go there. And people have got a pretty good sense of that. Like, for example, I'm pretty good with anger. I'm pretty good at not being freaked out by anger. So people get angry around me. Whereas I don't think they would get angry around someone that couldn't handle that emotion, you know? Because they go, okay, this guy can handle that. They have an instinct for it. It's like the body has an instinct for that.
Yeah, sometimes saying you are being angry in a very weak way. Let's start yelling. I was trained also a bit in this spontaneous scream technique, but it's too violent for our time.
Much for that, yeah.
Yes, I was taught how psychotherapy as naked in a group, and it was very stupid and proved nothing, but still very old experiences. Old body psychotherapy leaves the patient without naked and shitting their pants, and I am much more gentle after being exposed to all these toxic styles of work.
Right. I mean, interestingly, in Eastern Europe, because the sort of first wave hit later, generally, you can have people like you who have been experienced in both the sort of 70s approach, which was going on in England before I was born, right? And, maybe when I was a 10-year-old, it was still happening, but certainly not by the time I was a 20-year-old, it was kind of out of fashion, in the 90s. Whereas what we see in some of these European countries is this first wave comes later. And now you're also getting, what's that?
It was this first wave who came later, yes.
Right. So you got the first wave like 20 years after, but you're now, because of the internet, you're getting the modern wave at the same time, right? You're getting all the same speakers and CDs and all podcasts that we get. So it's like, it's almost more condensed experience. You know what I mean? So it's like you've been through that 70s cathartic, screaming, throwing up in a bucket, getting naked and going, okay, that's not so wise to do that all the time, and particularly with your client group. But now you're also seeing the modern movement, right? Like Wim Hoff does stuff in Poland every year. And, you're on the internet doing breath days with Dan Brule.
I'm very happy that I started Wim Hof methods 3 months ago. And I'm going to be an instructor. And I want to study this type of breathing for my patients. It's a great idea to introduce breathwork the way he is introducing breathwork, and his style, while I'm going through fundamentals course now, reminds me of old rebirthing sessions, because he's saying breathe into it, accept tingling. So it's a very nice thing for healthy, for the healthy. With the people who are sick, I always start very slow, very nice, For me, in a real body psychotherapy, not the 70s wave of abuse, we are working without scratching the resistance. We want to melt the resistance through breathing, through different experience. I believe it's more effective.
Okay. Well, I like the Wim Hof method myself. I was doing the Wim Hof breathing this morning, so I do 3 or 4 times a week. I find if I do it more than 4 times a week, I get a little bit hyperactive and crazy. So I found that's my sweet spot for ADHD boy. There's a different sweet spot for everybody else, but 4 times a week. Since I was also swimming in the sea yesterday at 9 o'clock in the evening as the sun was going down, to the amazement of some people around. It was nice. That was banned in England. We weren't allowed to swim in the sea, so I'm quite happy I'm allowed to swim in the sea again.
Wonderful.
The police coming to
I like this part of Wim Hof, really.
I think the Polish mountains would be a bit colder, though. I've heard there's a pretty hardcore course in the Polish mountains.
Yes. The next year in a different mountains than usual, but it will be held in Poland. And now I think Wim Hof method may change lives of many individuals. So it's nice. I like his approach without ego, like he says, no ego, but we go.
Yeah, he's like a fun guy.
rainbow shitting, you know.
My friend Tim works with him quite a lot and says he's a good guy. So this is Tim from the Netherlands. He's a trainer.
Yeah, we have a contact.
Yeah, you
after the Breathwork day, we are.
Well, I'm glad that maybe if you when we need to be hooked up with anyone else for the Breathwork day, let me know. I like to connect different people and, you know, kind of build the network that way. And I think the internet's doing this wonderful thing now that everything's being put out there. You know, like I can talk to someone in Poland. We can do someone is listening to this podcast in Kenya. You know, the next guest will be from Canada. You know, this is like kind of wonderful modern world now where it's all, we don't have kind of communist governments banning bookshops and saying that you have to have stolen paper to print the book on anymore. Yeah. It's almost a different problem. There's almost too much out there now. That's the new problem, you know, it's just you're drowning in it.
Yes, but still, variety is better than communism and fanatism. I would like to go back to results of my research on breathwork. So I'm still working on publishing the full paper. It's a large effort, really, but the results are quite clear. The patients, I have a group of selected breast cancer patients. They were pretty much the same, and ladies were training with me in two groups. One group had normal contact, verbal session plus relaxation, and the other group had breath work with circular breathing of around 10-12 breaths per minute. So it's rebirthing breath work for 30 minutes a day, about a day, during intensive training part. And ladies who had breath work training, they after completing radiotherapy, 8 to 12 weeks later, they have a larger amount of natural killer cells in their blood, despite radiotherapy and chemotherapy, comparing to control group. And that shows the power of breath work. There was a research on pranayama teachers and yoga teachers. They had natural killer cells activity measured and alpha waves of their brain, and only during pranayama rhythmic hardcore breathing there was a change in natural killer cells activity. And during the 10th session of my breathwork group, I collected blood after 30 minutes. Of course, it showed that there is a diminished level of carbon dioxide. Of course, partial oxygen pressure is a little lower, but there was a prolactin who went up. And cortisol, prolactin, this is a hormone, prolactin.
It's the one that you have when you orgasm, is that right?
Yes, and this is the bliss and breastfeeding. During orgasm, during standard sex, did you see the research? Only standard sex, vaginal sex, give you the total prolactin release comparing to oral sex. Very interesting research.
Oh, really? I heard that oral sex and standard sex reduce depression in women as long as they're not contraception is not used. So you know, this is the depression cure that I sometimes recommend. But so tell me the evidence base again, because I'm a pervert and I want to know. So what was it? Tell me the evidence again. So standard vaginal sex with or without protection?
I don't know if they measure. I don't know. It's not my research, but I received it as a Valentine.
And so even without an orgasm, there's still a positive effect. This gives a very good excuse to us men now.
It had to be an orgasm, and then they studied prolactin.
Okay, so if there's an orgasm, there's more of this. There's more of this hormone.
Yes, but during standard vaginal sex, so it was very fun observing. But I would like to summarize this thing with prolactin.
Yes, please.
There is one thing with natural killer cells. They are more active when there is prolactin, more prolactin, and they are less active when there is a lot of cortisol.
Yes.
So after 30 minutes of good breathwork session, it was session number 10, so ladies could really breathe. Yeah. Yes, this was shown that 10th session reduced cortisol and increased prolactin, and these two factors are increasing activity of natural killer cells in vivo and in vitro. This was research of someone else. And after all, I have a small analysis. It's not still published, you know, I'm struggling a bit, but I'm writing. I promise I will publish it. The higher blood pH went up during the last session. So the heavier the breathing was, yes? It was related to the increase in number of natural killer cells. So good breathing.
The stem cells that kill cancer cells and
yes.
HIV patients.
Natural killer cells are basically killing cancer cells.
They're like your natural bodyguards, right? They run around your body beating the shit out of cancer and diseases.
And certain viruses also. So, when you have cancer, it's good to raise your pH blood using breathing, rhythmic breathing to release prolactin. Probably it's good to have sex, I think. And you have to reduce your cortisol. So all the breathing techniques and anything that could lead to such result will help your immunity. So this is the idea from analyzing about 450 data I have in my database.